Hello and welcome back to Unacademy. So let's get NEET PG. Myself, Dr.Muskan Chaudhary, and today we'll discuss some images from the fungus. We'll cover the images regarding that. So starting with the Unacademy. Unacademy is India's largest learning platform where we get access to both the live and the recorded sessions, learning from the India's topmost educator for any medical examination, competing in the live T&Ds, studying on the device of our choice, and assessing up to 25,000 of the MCQs with printed and the digital notes. Under icon subscriptions, Unacademy Platter has come together where we get access to clinical, integrated, essential video lecture queue banks, team notes with live batches, recorded session queue banks, and the printed digital notes. Under NEET PG Plus category for 2 years, it is around 36,000 rupees. That will cost us around rupees 1500 per month. And for Iconic, it is for 2 years, it is 2438, costing us around 58,500 for 2 years. Please do use my code that is Muskan10 to get 10% off the further discount. Updated highly effective Q banks with 25,000 MCQs and with detailed explanations. Special class features includes the interactive live classes, attend the live classes, participate in the live chat, do the polling for the live chat, raise a hand, get your doubts resolved in the real time. Never miss a class because you will get the notification for the same. Download the lecture note and get access to recorded sessions anytime and anywhere. Target need batches with well-structured batches, modules, GTs, clinical essentials, PDF notes, and practice Q banks. And with 24-month subscriptions, 4 months is totally free. With 12-month subscriptions, 2 months is totally free, and with 6-month subscriptions, 6 month, 1 month is totally free. The offer is always till valid till now. So focus FMG batches where we get well-structured batches, FMG GTs, recorded sessions, Q banks, and the practice questions. Now we'll start with the first image. Yes, please identify the image. Yes, you can clearly see the hypopigmentation over the back areas and without any scaly. So what is this? This is actually one of the superficial mycosis. That is we are talking about. We are talking about Tania versicolor or Pitriasis versicolor, or that is what is a causative agent. The causative agent is what? Malassezia fur. And what is important thing that it cannot be grown on the normal SD culture. Therefore, what we use the Dixon agar media or modified Dixon media. Right. Apart from this, for the diagnosis, one we are using the culture isolation using the culture, the Dixon media or the modified Dixon media, and the skin scraping with 10% of the K, which very important finding that it will give the spaghetti and the meatball appearance. Is due to presence of the hyphae, and that is also known as this is also known as the banana and grapes appearance. So it will give us spaghetti and the meatball appearance or the banana and grapes appearance. All right, and the culture, for the culture we already using the Dixon media, modified Dixon media, and on the SDA that when we use the SDA, it will give the fried egg colonies. If we use the lipophilic SDA agar media, it will give the fried egg colonies. And what color it will give on the wood slab? It will give what? Golden yellow fluorescence. So this is to remember golden yellow fluorescence, spaghetti and meatball appearance, banana and the grapes appearance, and the fried egg colonies. And it is superficial mycosis, tinea versicolor, pityriasis versicolor, and the causative agent is what? Malassezia furfur. And if you remember, it is the only fungus that is acting as a super antigen. Now coming to the next one. Now please identify the image. This is also one of the superficial mycosis, and this is white nodule or white pedra, and it is less firmly attached to the hair shaft. Less firmly attached to hair shaft. And what is the causative agent? That is the Trichosporum vigilant. Okay? And it is white to off-white nodules that is present of the hair shaft. And what is the most common site? Is the pubic hair. Alright, so this is the white nodule over the hair shaft, and the pubic hair is the most common site, and the causative agent is the Trichosporum, and it is one of again superficial mycosis. Now please identify this image. Yes, so this is black nodule, or we can say this is black pedra, another one of the superficial mycosis. And what is the causative agent? It is the Petra horte. Alright, it is a black to brown hard nodule, and it is very firmly attached. It is firmly attached. So it is not easy to detach it. Firmly attached. And what is the most common area is the scalp here. So that was the white nodule. This is the black pedra, and this pedra hot is the causative agent, and it is present over the most common site is a scalp hair and causes the black nodule or the brown hard nodule of the hair shaft that is difficult to separate. Right. So moving to the next. Now it is one of the dermatophytes that is also superficial mycosis, and dermatophytes that is also known as the Tania or the ringworm, and they utilize keratin over the skin, hair, and the nails as their nutrition. By the shape of the dermatophyte, we can identify to which of the following dermatophyte it is. Now, the dermatophyte belongs to which class? That they are Deuteromycetes. That is the fungal imperfecti. Deuteromycetes that is not having any kind of sexual spore, that is fungus imperfecti, and they have dermatophytes. Next, they have is the Candida, and very important one, that is the systemic fungus. Which dermatophyte is this one? This pencil shaped. This is pencil shaped trichophyton. All right, and they have few macroconidia and many microconidia. They are pencil-shaped macroconidia, that is few macroconidia with many microconidia. Trichophyton, what does it involve? Tri, that is skin, hair, and nails. All right, so they will involve all the three. Now coming to the next image, identify this one. This is also one of the dermatophytes. So we have already done with the trichophyton. The rest is the microsporum and the epidermophyton. And this is spindle shape, or we can say that is the boat shape dermatophyte, that is Microsporum, and it has many microconidia, many macroconidia with few microconidia. All right. And what does it involve? This is how we write M. This is how we write it. All the dermatophytes will involve skin. Along with that, M will involve hair. That is skin plus hair. It will involve. That is the microsporum. That is the spindle shape or the port shape. Now coming to the next, again, last dermatophyte. This identify this dermatophyte. This is this is club shaped macroconidia with no. You can easily see with no microconidias. This is what? This is the epidermophyton. This is what? This is epidermophyton. Now, what will it involve? It will involve skin, and what else we are left? That is the nails. So we have trichophyton. This involves skin plus hair plus nails. Then microsporum has skin plus hair, and then epidermophyton has skin plus nails. Now, moving to the next image. Identify this one. Okay, so what is this image? Now, this is Rosegardner's disease or porotrichosis. This Rosegardner disease porotrichosis that is caused by what? That is a Sporothrix shanki. And what it is dimorphic fungus, systemic fungus, and that is examples are the HSBPC for the dimorphic fungus, that is the histoplasma capsulatum. Then we have the Sporothrix shanki. Then we have plastomycosis. We have the penicillin manfi. Then we have the coccidioids and the paracoccidioids. Alright, so these are the examples of the diamel fungus, and what is the meaning? That is having two morphological forms, yeast at 37 and mold at what temperature? 25 degrees Celsius temperature. This Portix shanky, and you can see the classical pattern of the chronic granulomatous disease that is spreading along the lymphatics in the peripheries. That is why the traumatic inoculations of the conidia, and what else it has? It has cigar-shaped asteroid bodies. Seen where? Seen in the sub-Himalayan regions, sub-Himalayan and the Himalayan regions. And what is the drug of the choice? Drug of the choice is itraconazole. All right. Now identify this image. Now this is what you can see. This is again. This is the cigar shaped. This is the cigar shaped asteroid bodies. Cigar shaped asteroid body that we see in the Sporothrix shanky. Alright, this is a cigar-shaped asteroid body seen where in the Sporothrix shanky. Now identify this one. One of the subcutaneous mycosis. That is Yes, so this is the chromoblastomycosis. And what are we seeing? These are the copper penny bodies or the medlar bodies or the muriform bodies or what is named sclerotic bodies. All right, and they does the coliform like granulomatous lesion and one of the subcutaneous mycosis. Now, hmm, the treatment for the chromoblastomycosis is difficult and it is mainly surgical treatment. Going to the next image, identify this one. Now we have some few fungus which cannot be grown in the artificial medias. What are the list? One is the Rhinosporidium, sea berry. Next we have is the Leucasia, and next we have is the Pneumocystis cerevisiae, that is RPL. Now you can easily see one of the polyp, the red polyp, that is vascular polyp. And what is the most common area? That is the nose and the conjunctiva. We are talking about the Rhinosporidium seaberry. Alright, Rhinosporidium seaberry that was found in mainly in the coastal areas of India and in the Sri Lanka. And this is the polyp with the white studs, and these white studs contain the spherules containing the sporangiospores. Alright, now treatment we give the radical surgery. We do the radical surgery with the dapsone, that is the treatment for the rhinosporidiosis. Hmm. Now, coming to the next one, identify this image and what is it. Yes, what is this? This is the east budding form. This is the east budding form. For what? That is for the blastomycosis. So we write B, this is how we write 8. And with the, this is how this, the 8 is like this, that is a broad base. Broad base is the east budding form with broad base. All right. So this is the blastomycosis. What is the other name for it? This is the North American blastomycosis or gilt Christ disease. All right. Now move to the next. Again, it is also a diamondy fungus. Now identify this one. Yes, what is this? This is the cartwheel appearance or the pilot wheel appearance that we see where we see in the paracoccydoids. And this is again the east budding form because they are dimorphous east budding form. That is the pilot or the cartwheel appearance and even the Mickey Mouse appearance. Now, what is this? This is a germ tube test or Reynolds Grande phenomena, and which is shown by the Candida albicans and sometimes by Candida dubliensis. Now, coming to the next image. Easy one, we can easily see capsulated structure, and the only capsulated fungus that we know is the Cryptococcus. That is the only capsulated fungus, and it is what very important point that it is a true pathogenic yeast. All right, and what we have one is the Cryptococcus neoformans and Cryptococcus, that is other non-pathogenic species. Cryptococcus neoformans, they can grow at 37 degrees Celsius, and they shows the mouse pathogenicity test that is positive. Here it is not. Then talking about the Cryptococcus and neoformans, we have already talked that is very important point that is the capsulated fungus and it is true pathogenic yeast. On the basis of its capsular antigen is further divided on A, B, C, D further subgroups, and B and C is the gutti. That is a subgroup B and C, that is the Cryptococcus gutti, and we have the Cryptococcus neoformans, that is subtype D, and the Cryptococcus subtype A, that is the Cryptococcus group. So Gatti is B and C, and D is the Cryptococcus neoformans. Now Cryptococcus neoformans and Cryptococcus Gatti, some difference are there. That Cryptococcus neoformans is worldwide in distribution. Here it is tropical and the subtropical areas, and it is disease of immunodeficient people only. It is immunodeficient or immunocompetent people, both will be involved in the Gatti. All right, and it is found associated with the soil that is enriched with that of the pigeons excreta. All right, and it is found on the soil that is enriched with the eucalyptus tree, and it is sensitive to antifungus, and it is therefore easy to treat while it is difficult to treat. Alright, so neoform is in the gutty. Neoform is the worldwide distribution, and it is mainly in the immunodeficient, with easy to treat, and it is found enriched soil enriched with the bats, so the pigeons excreta. Then capsule is the main valence factor, and what are the valence factor? This ability to grow at 37 degrees Celsius temperature. Then apart from this, very important, the Cryptococcus is responsible for the meningitis, that is acute and subacute or chronic meningitis in the HIV people, mainly in the immunodeficient HIV people. Apart from this, in the skin, it can cause the molluscum contagiosum like lesion. And what do? We stain it with that of the India ink preparation or the nigrosin stain or the negative stain, and to stain the cell wall, we use the mucicarvine stain. Other than this, we use the PAS stain and the GMS stain to stain the tissues biopsies. And we use the Niger seed agar or the bird seed agar, which contains the caffeic acid, and it demonstrates the production of the melanin that and form the chocolate round colonies. Alright, drug of the choice is the amphotericin B with the fluoxetine. Now moving to the next image, identify the following image. This is this is Aspergillus, and what is the important to point remember about Aspergillus that they show the acute angle hyphal branching, and to which group they belong? They belong to the Ascomycetes. Alright, they belong to the Ascomycetes, one of the important opportunistic and the deep mycosis fungus. Now, coming to the next one, this is the ping pong ball appearance. Where do we see? We see in the Pneumocystis aerobacilli, and under the GMS stain, under the Gomoris methanamine silver stain, we get the ping pong appearance where the cell wall is actually dark. It stains the dark and the background will be green. Pneumocystic aerobacilli, which was classified as the protozoa, but now it is considered as a fungus on the basis of the presence of the ergastro, on the basis of the studies on the mitochondrial DNA pattern and that of the EF3 factor, that is now it is classified as a fungus, and disease it causes the mainly pneumonia, that is the bilateral interstitial pneumonia, one of the important opportunistic fungus. And for the diagnosis we use the induced sputum or the bronchial vein lavage or the biopsy. And what is the drug of the choice is the cotrimoxazole. All right, coming to the next image. You can see the branching that is at acute angle, and we have the acute angle branching in the A4A, that is the Aspergillus, that is the Ascomycetes, and they are highly septate mold that shows the branching at the acute angle. And what are the risk factors? Risk factor are the glucocorticoid people on the glucocorticoid or the neutropenic patients, and it causes the allergic bronchopulmonary lavage or a very important corneal ulcer wound. Apart from this, it is the colonization of the preformed pulmonary cavity that is leading to the invasive pulmonary aspergillosis. Most common risk factor is the neutropenia, and the most common species for the invasive pulmonary aspergillosis is fumigatus. All right, and the most common site of the spread is what, the brain. And what the treatment we give, the use, we do the surgical resection with that of the voriconazole as a treatment. And superficial mycosis, it is causing the paranasal sinusitis, that is Aspergillus flavus, and the otomycosis, that is Aspergillus niger. Now otomycosis, that is Aspergillus niger, and the for the sinusitis, that is a flavus, and the fumigatus is the most common species causing the invasive pulmonary aspergillosis. And the one more thing is the alpha toxin, that is the mycotoxin, that is released by which Aspergillus flavus. All right. Now, this is the difference just to show this is a hyaline septate mold, that is acute angle branching, that is this is aseptate hyphal mold. And in the mucorrhizopus or the zygomycetes, where there is broad angle branching, and here it is, you can see branching at 90 degree. So that is the broad angle branching. Okay, so that was it for today's session. Please do use my code to get the subscriptions, and thank you. Please do use my code, that is Muskan10, to get further 10% of the discount. And I'll see you in the next session. I hope the session was very easy. It was purely image based sessions, and we covered in a very short duration of the time. So I'll see you in the next image. Thank you and bye bye.